toxins as well as other toxins are metabolized from the body.
So what we're trying to say is trying to tell everybody that it's not just cleansing your body of all the toxins that get accumulated, but is also producing a lot of other substances, right? So what are the substances that the liver produces? For example, we know that all the glucose that we take in gets converted and stored by the liver. Then there's a lot of other vitamins and minerals involved. So could you mention a bit of those?
Yes, in close collaboration with pancreas, it actually regulates the blood glucose level in the body, especially in the month of these Ramzans when we are fasting. The glycogen stores which are inside the liver, these are the extra sugar which normally liver is stored inside the liver. These are released to maintain the blood glucose level in the body.
So now we know all the medicine, everything has to be eventually metabolized by the liver. Coming to hepatitis, I would really like you to highlight hepatitis. Why? Because what happens with us is that, we have actually applied for a visa somewhere. It's a student visa, or we're going for Umrah or a vacation, and then right at the 11th hour when we go for our test and the report comes back, it says you're hepatitis C positive, and then all our plans are just right there. And that is what it is. It's a latent disease that inside you, it's hiding in there, you don't know it's there, and then some 20 good years later, it converts into a liver cancer, which is much more difficult to treat. So could you shed light a bit on hepatitis C, how it is spread, and how we can, how important is its testing, and if somebody is diagnosed, how important it is for them to take the interferon or the course, the 6-month course, and get themselves cleared.
Yes, it's very important. Pakistan is one of the most prevalent, 1.8 and 2.5% is for hepatitis B. It's actually spread by, it is blood-borne disease, and the diagnosis for hepatitis C and B is now very simple. There are readily available kits, and results are within
Why are
hours.
people scared in our part of the world to get tested? They know that they're exposed to it all the time, syringes or blades or anything. When you go to the parlor, when you go for anywhere, right? You could contract it, but people don't want to get tested and they don't get to get treated as well. So can you shed light on that?
It's basically lack of education. The major part is lack of education. Now, the treatment of hepatitis C is now very easy. Now, the era of injection interferon has gone. Now, there is a 3-month course of direct-acting antiviral tablets, which are readily available via government programs. It is free of cost. It is easily present with patients.
And if somebody just leaves it, because it's latent, you won't see any symptoms, you don't know it's in there, right? And if somebody leaves it untreated, what happens later? What happens years later to the liver?
Down the line, after 20 years or 25, 30 years, the cirrhosis occurs. Cirrhosis is basically the damage of the liver, and this occurs in 20% of the patients.
Okay, and when you say that the liver is damaged, what are the signs and symptoms that lead to liver damage? We know that yellowing of skin is the jaundice, and then we do know pale stools and dark urine and itching. We get a lot of patients in our clinic that come with this generalized itch all over their body, and they're applying all sorts of steroid creams and everything, and they don't know that the itch is actually due to the liver not being able to detoxify. So what are those symptoms when you know that you are actually going towards liver cirrhosis and failure eventually? What are the symptoms?
Giving order with symptoms until and unless it gets damaged up to its end. The initial symptoms are weakness and followed by fluid coming in the tummy, like ascites, and followed by vomiting of blood, nauseating symptoms, and also patient gets drowsy and then came in coma as well.
So when you're talking about this extreme symptoms, it's that when the fluid